Hey beauties. I wanted to come on and do a update on my recovery from surgery. Today is 4 days post-op, and as you can see, today I'm revealing the scar. It looks really bad right now, but that's from the purple ink that the surgeon used to mark the area they were going to go in at. So it definitely won't be that dark. It just looks horrific right now, but it is pretty bad, and it's like gross to me. At this point, it's still swollen, especially like right below it. I can feel like where the swelling is at, but it's not infected. No sign of infection. It's clean. It's like, it looks like what it should look like. So that is super awesome. Symptoms I've been having today, and today's Friday, by the way. Still having numbness and tingling on my right side, but it's not as bad as it was yesterday. It's kind of off and on. This morning I woke up at 7 and I had, like when you go into a higher elevation or you fly in an airplane, your ears get really clogged up. So I weirdly had that happen from like 7 to like maybe 11 this morning. And that was definitely something new that I'd never experienced before. I kept trying to yawn, to unclog my ears, and it didn't help. So it kind of just like went away on its own. Right now I don't have that going on, so I guess that's a good thing. It was kind of starting to drive me crazy. At one point it felt like my ears were just ringing for like about an hour or so. Throat's still pretty good, a little bit sore occasionally, but not that often. Left side, no pain, which is good. Well, not my neck, but left side of like my back and my sides. There's no numbness, no tingling, no pain. It's like yesterday I said, mainly my neck, shoulders, in between my shoulder blades is where most of my pain is when I lay down. I'm having a hard time getting comfortable today in one certain spot. Still using ice like often during the day. My medication I'm still taking as prescribed. I'm almost finished with the steroid medication, so then I'll just be down to Flexerol and Dilaudid for the pain. And I've noticed that the Dilaudid, like the first couple days I was taking it every 4 hours. As soon as the 4 hours hit, I was like taking another pill because the pain is really bad. But like today and yesterday I noticed it's like more at like 5 hours, and I'm spreading it out a little bit more, so that's good. That just tells me that I can get through the pain a little bit better. Still drinking fluids. Biggest symptom, I don't think I mentioned this, is lightheadedness. So I've had like lightheadedness since I had surgery, but today is probably like the worst day that I've had it. It's really bad, you guys. Like I guess I had it yesterday pretty bad too, but today, like, I can't even, like, if I go into the living room, I have to hold myself against the wall as I'm walking through the hallway. And yeah, I just feel like I'm gonna pass out if I stand up. So I'm just trying to go to the bathroom and back and not really get up at all unless I have to. So that's really, I guess that's probably my biggest like bad symptom for me is the lightheadedness, just being lightheaded all the time. It really sucks. And then today, I started feeling some anxiety. Actually, yesterday I started feeling it a little bit last night. And I know I have PTSD. I've had it since 2005. So I take clonazepam on a regular basis, or like as needed. Pretty much it's like once every 2 days or once every 3 days. I normally have to take one of my pills. And I hadn't taken any since Monday, so I took one last night and it helped. And I woke up from a nap today and it was just really, really bad. It was a severe anxiety attack where I could feel in my chest, like my breathing was really labored. And my heart rate just, I don't know, everything. It was just a bad anxiety attack. If you have PTSD or you get anxiety attacks, you'll know what I'm talking about. So I actually had to take 2 of my anxiety pills today to try and treat that. Right now, I feel better now that I took that second pill. So that's good. But yeah, that's, I guess, a new symptom dealing with the surgery. If you're new and you haven't seen any of my past videos, this is the first one. This is in a collection, I guess, I'll like log them together on my YouTube channel once I'm finished with them. But or once I have time to do that. I had cervical disc, total disc replacement surgery on my C5, C6 disc. They went in and removed bone spurs, bulge disc. It was a bulge disc, the C5, C6, and so they put titanium in place of it. And in the paperwork, it doesn't tell specifically what type of titanium piece they put in there, but I asked the surgeon before, and I think he said it was the Mobi C. I know he said C, so I'm pretty sure that's what it was. Yeah, so pretty much I called the nurse last night because I was kind of worried about like all these symptoms with tingling and numbness and being so dizzy and everything. And she told me not to worry. She said that is actually common for this surgery. Some people that don't experience symptoms like that will actually start having symptoms. And it's kind of just one of those things where they can't tell me, what's going to happen, like when it's going to get better. I just kind of have to wait and try and be patient and play by ear. And hope all goes well, and hopefully, these symptoms die off and the pain dies off, and I can start back at work next week. So that's what I'm going for, is to start on Tuesday to be able to get to that point. Sorry, I look crappy today, you guys. Yesterday, I think I looked even worse. My hair is oily, so definitely need to wash that. But I wanted to get this off, the dressing off, because it had been on there for, it's never been completely uncovered before. So I wanted to, wash it, let air hit it, and, see how it goes. But yeah, I look like crap. I tried to put eyeliner on earlier, because anybody that knows me knows that I wear eyeliner religiously. And I am so shaky from, I guess, just, nerves and probably the fact that I'm really lightheaded and everything like that, that I tried to put my top line on, and it was all over my eyelid. It was so bad. So I just said fuck it and didn't put anything on. Yeah, so that's where I'm at with that. But I think I'm doing okay. I'm making progression. I'm trying to be positive. My mom's helping me out a lot, which is awesome, because obviously Kevin is not here to help me. So, yeah, I'm glad that I have, her to help me out a lot. And the dogs are here with me, and usually they're pretty good, but sometimes they get really riled up, and I have to tell them to calm down and get off my bed. But, yeah, it's just crazy. I don't know. Super crazy. So I'm trying to stay positive and hope that, things are going to get better and not get worse with more symptoms that I never had before. Sorry it's so bright. I added an extra light because my room is so dark, so you guys could be able to see the incision, and I'll do a close-up again. And like I said, the purple is the pen from the surgeon, so it'll actually be lighter than that. It's going to lighten up. It's not going to be that dark, which is good, thank God. But I look like right in time for Halloween. I look like I tried to slit my throat or something. But anyway, that's what it looks like now, 4 days after surgery. So my dad was actually telling me about, because he works with CBD oil and stuff like that in California, and he was telling me about how he's come across, or he's read about certain organic oils or creams or something like that help with scars like this disappear at a lot quicker rate than just naturally letting it disappear on its own. So I told him if he comes across it, let me know what it is, because once it's completely healed, then I definitely want to try it, because I'm not about walking around with this massive scar on my neck forever. Or I'm just going to have to wear turtlenecks and scarves for the rest of my life. And yeah, have you seen me? I probably wouldn't look good in a turtleneck. I don't mind scarves, but yeah. Anyway, I'm rambling now. I'm about 10 minutes in, so I'm going to end this video. This is the update for 4 days past my surgical operation on my cervical total disc replacement surgery for the C5, C6 Mobi C. So if you guys have any questions, please go ahead and comment down below. Ask me any questions. I'm more than happy to answer them. If you like this video, go ahead and give me a thumbs up. And I will talk to you guys later. Bye.